Do we overdiagnose prostate cancer, and do you think that we have the technologies in place now where we can actually better diagnose those who need to be diagnosed and better treat those who need to be treated?
So the first answer is probably yes, we do overdiagnose. And part of that is because we don't have a better test other than the $30 PSA test, which is the blood test that's for prostate-specific antigen. So one of the struggles there is that if you globally state that this is the only tool we have and you screen everybody, you will pick up a bunch of folks who don't have a problem. But to then globally say, well, now we're going to take the opposite approach and say, well, this test is really perhaps not any good, and now we're over-screening, over-treating, and whatnot, I think in some ways does men a disservice, because that may be the message, but what people are hearing is, oh, good, I really don't have to worry about this part of my health. And it sort of gives them this free pass. And I think that's not really the intent. Even if the U.S. Preventive Task Force gives it a grade D rating, it does not mean you don't talk about it with your physician. So there is an overdiagnosis, but in absence of something really terrific out there, to just throw this one away does not make any sense. I think the second issue is that that's globally true perhaps in a discussion setting where you have mostly Caucasian males who are asymptomatic, no family history. But of course, where I practice down in Detroit, where the majority are African American males, I think that is completely not applicable. And although the AUA, as I understand it, has changed their position to perhaps support lack of PSA screening, there is a movement started by one of our own urologists to actually write a paper to counter their recommendation. And so there is a task force now in place to state that if you have a family history and or African American race, that perhaps these global recommendations do not really mean anything. And so my hope is that, yes, the research needs to continue. If you look at how many biomarker studies that are ongoing and you look at any one time, there's probably been at least 20,000 papers on biomarkers in prostate cancer. We're still stuck with PSA. So we've got a long ways to go, but I think the only way to get there is to continually do more testing. There's obviously newer things, which I'm sure you guys may even be using to at least determine aggressiveness, biologically, how aggressive is it going to be? Those are the kind of questions that we want to know.